to give stability to an MCL sprain of the knee. Okay, so you want to position your patients so they've got slight flexion of the knee, about 15 to 20 degrees, and then they need to maintain that through the technique. So we're going to apply an anchor around the thigh. Okay, so again, this is one of those techniques which is better if your patient shave the leg first. Okay, and then we're going to do similar on the medial edge of the calf. Okay, so areas that you need to take care. Don't try and compress too much going through the top of the patella or going through the VMO. As the leg bends, the patella needs to track upwards and the VMO needs to be able to contract as hard as it possibly can in certain movements. So try not to cut in through that area with the tape. So what we're going to do is work across there, laying virtually no tension, just the tape being laid down on the skin. And then we're going to work from the back of the joint forwards as well, crisscrossing at the joint line. Okay, we're going to do one more in that weaving pattern. Okay, I'm going to do some longitudinal strips now. Okay, and that's the weaving pattern finished. So now I'm going to go over the initial anchors again. And that's the rigid technique finished. So now we need to reinforce that tape so that it's not going to be prone to ripping. So I'm going to come down, covering the strips at the front first. So if you needed to do this quickly, you could do this as one long continuous strip coming up and down, but it does make it difficult to set the tension properly on the tape. Okay, a little bit of tension as you go across the joint line. Okay, so going around these anchor points now, not putting too much pressure on the tape because you don't want to cut off the circulation, especially if your athlete isn't warmed up yet. Okay, and again on the lower thigh. Not too much pressure. We refinish those anchors, so for durability you probably want to go right around the muscle, and again try and get the patient to contract the thigh when you do this last anchor. And the same thing on the calf. Okay. Give everything a press down, and that's your MCL strapping technique finished.